Hello everyone, I'm Dr. Monica. Today's video will be on topical anesthesia in dentistry. So to understand topical anesthesia, we must understand what is local anesthesia. Local anesthesia is the loss of sensation which is caused by reversible blockade of a nerve conduction around the site of application. So local anesthesia, it is of three types. First one is the conduction anesthesia, second one is infiltration anesthesia, and third one is topical or surface anesthesia, which we will be discussing now. So why is topical anesthesia used during dental treatment? So whenever the topical anesthesia is administered at a local site, it produces less side effect. It is easy to administer. Also, it reduces pain caused by the needle injection, and thus it creates a positive response in patients towards the dental treatment. So what is topical anesthetics composed of? So it mainly consists of active anesthetic agents, vehicle or base, penetration enhancers, preservatives, stabilizers and antioxidants, flavoring and sweetening agents. So now let's understand the mechanism of action of topical anesthesia. So when it is applied on the mucosal surface, it comes in direct contact with the superficial epithelial layer. Then the anesthetic begins to diffuse into the peripheral sensory nerve fibers, and a higher concentration it helps in effective diffusion into these nerves. As the anesthetic penetrates these fibers, it blocks the nerve signal transmission, and by inhibiting these signals coming from the peripheral sensory nerves, it helps prevent pain sensation from being carried to the brain. So with nerve transmission blocked, the pain threshold of the superficial mucosa increases, results in reduced pain sensation in superficial mucosa. There is no vasoconstrictor added, which avoids reduced mucosal permeability and enhances the diffusion of the uh, topical anesthetic properly. So overall outcome is effective superficial anesthesia, which allows procedures to be performed with minimal discomfort. So various anesthetic forms include sprays, so which can be used prior to taking oral radiographs and prior to taking denture impressions in patients with excessive vomiting reflex, and also pediatric patients for tooth extraction. Coming to the solution form, it is used to cover a wide surface area without the risk of aspiration. Whereas gels and sprays, they are used for pain relief caused by laceration and abrasion. So coming to how to apply topical anesthesia. Firstly, dry the mucosa or skin before application for better absorption. Apply using spray or cotton swab with minimal required amount. The usual onset time is around 2 minutes and duration of action is 10 minutes. So if the topical anesthesia is highly concentrated, apply thin layer over a small area to avoid toxicity. So coming to the indications for topical anesthetic use in dentistry. First one is needle insertion for infiltration anesthesia. They can be used to control pain in wounded area, also before the placement of orthodontic bands, and to inhibit the vomiting reflex for radiographic imaging or impression during dry socket and during simple extraction of deciduous teeth, during rubber dam clamp placement, during abscess incision and root planing and scaling, or inhibition of reflexes during endotracheal intubation. So coming to the topical anesthesia types, we have non-aqueous and we have aqueous. In the non-aqueous, we have benzocaine and lidocaine base. In the aqueous types, we have benzyl alcohol, tetracaine hydrochloride, and lidocaine hydrochloride. So what is eutectic mixtures of local anesthesia cream? It is nothing but a combination drug mainly made up of lidocaine and prilocaine, and it is a commercial drug which has a lower melting point, and its usage leads to easy absorption into the oral mucous membrane, and which leads to minimal pain during dental procedures. So few latest topical anesthetic agents used in periodontal procedures include: first one is Hurry-Pack periodontal anesthetic kit, second one is lidocaine topical anesthetic, third one is Orakick subgingival anesthetic. So coming to the rare but few side effects of topical anesthetic use includes that it causes a tissue stimulation and also a temporary altered sense of taste. So if an allergy is present in a patient, the patient shows signs like itching, edema, swollen marks in the face and neck, nasal discharge, shortness of breath, wheezing and headache. If you have liked the content, please like, share and subscribe to this channel. Thank you.